Everybody, this is Monica Heltz with your Fishers Health Department update on our metrics. Today is Tuesday, November 17th. We are still in red. We have been in red for 2 weeks on our severe risk category, level 4 community risk rating metrics. Our percent positivity rate is 18% for the county. On individuals tested, that is in red. Our case incidence rate is 48.35. That is as of yesterday, and I'll explain that in a minute. 48.35, that means we have approximately 50 cases per day on average over the last 2 weeks, and that is rapidly rising. Our percent positivity rate for our Fishers Health Department testing site is a little bit lower. It's 6.7%, so that's slightly reassuring. But our 2 major metrics are in red. We continue to be in red. And severe risk category as far as our community spread, what we're seeing is a rapid rise and exponential spread among the community of this disease. And without some very strict measures, we cannot get this under control. So we are depending on you guys to please engage in only essential activities and only with members of your own household. And that includes your plans for Thanksgiving. This is absolutely critical if we are to save our healthcare capacity, make tests available for you when you truly need it, and have hospital capacity for you if and when you need it for COVID or anything else. So this affects the healthcare capacity in many ways, and it's not just COVID. If they are overrun with COVID, they will not be able to see you if you have appendicitis or some other emergency that you need to be admitted to the hospital for. So this is why these things are so important. So again, completely dependent on you guys to make these decisions to only engage in your essential activities with only members of your own household at this point. Thank you so much for that. Regarding our dashboard, those of you who follow us closely may notice that our dashboard did not get updated today on our community dashboard. Our Fishers Health Department dashboard was updated this morning at 8 a.m., just as it is every other workday at 8 a.m. So that one you guys should have full access to. And again, that's the data that we have control over, so we're able to continue updating that for you. Our community dashboard is dependent in part on data from the state. So this is the process that the state uses. So the labs report to the state when there is a positive, and then the state has to report it back to the local health department to follow up on those positive reports. So we have not received any positive report. We have not received any report of new positives today from the state, and they have told us that this is because their systems are overrun because of the rapid rising increase in testing and in cases. So they have been unable to produce that for us today. So we have not received any positive report cases from the state. We're still following up on all of the other cases that we have through our testing site. But again, we cannot produce that community dashboard that shows our true picture until we receive that information from the state. So we're looking for that information for a few reasons. I know you guys are looking for the dashboard, but just wanted to give you that reason why. That's the same reason we do not update it over the weekend and on holidays, is because the state does not produce that report on those days. Our public health capacity, those are our secondary metrics. I just want to go through those really quickly. We are seeing our public health capacity extremely strained, even though we have been well resourced and have been increasing rapidly in the face of these strains. We are still, again, not able to meet the demand that we're seeing due to the rapid exponential spread of this virus. So we're depending on you to stop that spread by stopping engaging in activities that are not essential. So our testing capacity right now, I'm putting at red. Our testing availability, is at red category, because our appointments on both our state link and our local testing link are booked out over 5 days. And that is with increasing the capacity by 100 people a day this week, and then we're adding another 150 a day next week at a second site to support school-related exposures. So with that, we're seeing nearly 500 people a day, which is a doubling from a couple of weeks ago, at our testing site, and we're expecting to add another 150 more on Monday, but we are still completely booked out. We're straining the lab capacity to be able to process this many labs, and that's both from the state standpoint as well as from our MACL standpoint, from our testing lab standpoint. Our testing turnaround has been relatively good. We continue to get our labs back between 1 and 5 days. I would say our Fishers only testing site, we're still getting labs back within 1 to 2 days. which would put that in the green category. But our state labs are coming back in 2 to 4 days. So I would put that at an average of 3 days. So possibly in our yellow category. Our tracing capacity, again, is strained, but we continue to be able to notify each and every person that tests through our Fishers testing site or is who identified as test positive through this, who has contacted the schools, and we're notified that way. We're notifying all of you guys within 24 hours of our information that you're a positive case. So you should be getting a notice the same day you receive your lab report or you report your case to the school. Our ability to do that follow up for the ones that are reported through that roundabout process through the state from the other labs, that is a bit delayed by several days. Again, we're going through those and we're following up on all of those, but that process has been delayed. And again, the state has informed us that their centralized contact tracing program has been completely overrun, and they're shunting a lot of that to the local health departments. So I would put ours in green, but the state's in red on that category for the contact tracing. As far as our healthcare capacity is decreasing. I'm going to put that whole category in orange right now. Our ICU bed availability is going down. It's decreased by 4.5%. And our the number of COVID beds in the ICU or COVID positive folks in the ICU has increased by 10%. 10.3%. And again, our capacity is getting really, really strained. And that affects, again, our ability as a healthcare system to serve you, not only if you have COVID, but also if you come in with something completely different, like a heart attack or appendicitis or a broken leg. This affects all of this. So we are, again, relying on you to engage in essential activities only at this point. In positive news, we're hiring more tracers. Our tracers are getting some really good feedback. They actually have really good feedback on the advice that they're able to give to people. So I would encourage you to pick up that call. They will walk you through this and make it easy for you. Our capacity is increasing, like I said, even though we're completely strained. We have added an additional testing site with additional capacity for more people, and we're exploring every possible mechanism to increase the capacity in every possible way that we can. But the whole system across the state is strained. So again, we'll continue to work those avenues. In vaccine news, we have 2 good vaccine candidates. None of them have emergency authorization use. So we're still a few months away from any kind of immunity as a community. That was funny. But it's on the horizon, and that is some very positive news with some very high efficacy rates, much higher than we would have anticipated, quite frankly. Although we don't know the long-term efficacy, I think the short-term data that we've seen is quite good. In the meantime, I would encourage all of you, again, engage in essential activities only. Please have Thanksgiving with only your immediate family. Be safe, wash your hands, wear your mask, keep your distance, and again, be healthy. Thank you so much. Bye.